Hi everyone, I am here today because I have my very dear friend, Dr. Eva Furnschuss from Austria here. Our friendship started when Eva came to my clinic in 2006 or 7, right? She came as a young student.
Young vet, just finished.
She asked me whether she could spend a year in my practice, so we became friends. And she now has a very successful holistic veterinary practice in Graz, Austria. She has built such an amazing system of healing that I would like to share it with you. And Eva is also very keen on making a difference. How did you decide to be a vet?
I knew it when I was 12. My grandmother was a herbalist, and so I learned so much from her. And even when I was little, I loved to work with herbs, with chamomile, and made my own chamomile tea and picked the flowers. And so I played with that when I was 4 years old. And my mom is really into herbs too, and it was just natural for me.
Did you know that my grandfather was a herbalist?
It's amazing.
We sometimes feel like our lives were just kind of like created
parallel.
in the same universal plot.
But then I was horseback riding, and I really wanted to become a veterinarian for horses, which I think is parallel too.
Because my first job was with horses, and I did horseback riding from the age of 11 until 27. So that's exactly the same. We're kind of perplexed by this. So anyway, you went through vet school.
In 2000, a friend of mine said that we have to find a niche because there are so many vet students, and we have to find something to be different. And there was a homeopathic class, and I really loved it, and I continued the whole process, and I took a 7-year course, very intense, parallel to my vet school. And then I met you, and you were the grounding of everything.
Come on.
Yeah.
What do you think of conventional medicine? What do you think of its place in the medical system? And what do you think is happening with connection of vet medicine with drug companies and pet food companies?
Well, I believe that they are really great in emergency and surgery. But other than that, they don't have the big picture. They don't see that everything is connected, and every spot on your skin is connected to your organ. So they don't see that. So when you go for heart failure, they only treat you for heart failure, and they don't see that it started with eating wrong or with your digestion, or they don't even ask you what happened like a year ago. They only see what is now, but it's also connected, so they cannot really treat especially chronic disease. The other thing is that I believe that the body expresses the soul, so every disease has to do something with your inner process, and so you really need to grow with any disease. So even when kids have a fever, I see them grow after the fever. So when you suppress the fever, you really see them stop growing. They don't make that process. You really need to go through a disease to be stronger, or
because if you have a symptom, it's the body's signal that there's something wrong, and you have to kind of let the system kind of support the body in the process of healing, but not to suppress the signals, because it's like the body's calling for help and you give it a mouth right?
Yeah, and then it goes to somewhere else, because it always has to find the vent. It needs to vent somewhere.
If you suppress the symptoms of, let's say, fever or diarrhea in the acute form, you may actually drive the disease deeper in, and then you get liver disease or kidney disease or serious cancer.
And then there is no return.
Yeah.
And then everybody says, "Oh my God, I have cancer. Why? How did that happen?" But it doesn't fall from the sky. It's built over years and years.
There is a way for us to listen, and obviously some of us have the genetics that we can't always
Of course, and I don't
disease.
speak of kids and who are born with cancer or who have cancer with 4 years old. I really speak of people above 40 or 50 even, that they get sick, and because they have this lifespan of suppression, and the body doesn't want to be tricked. You really have to listen.
But you know, people when they go to a vet or when they go to a doctor with their problems, they really don't have the medical education.
Yeah, you have to trust, but
Exactly.
you have to be responsible too, and you have to think. Don't give up responsibility. Never give up responsibility. That's what I see most clients do. They think the vet is the king and he's in charge, and I don't have to think anymore. But why? I mean, I have to think about myself, think about the animal, think about any patient.
So it's like, you know, don't always trust the doctors, right?
Never trust a doctor.
I think it's really important to be empowered, and this is actually what I love to do, to teach people. So when they walk in the veterinary clinic, they actually know exactly what to ask, what questions to ask, and how to
say no.
prevent,
You have to dare to say no.
Well, but sometimes, you know, if let's say a doctor says you have to get this drug for your dog because otherwise he's going to suffer or be in pain.
But then you can
again, the
say,
fear
I
kicks in.
have to make research. I will check myself, and I come back tomorrow.
I know that medicine is changing, but we all have dreams. And what is your dream of medical system for animals and humans? What should it look like?
Well, I believe that disease or health is an expression of your soul. So it's so important that you also always focus on your whole character and on your fears and everything, and we have that scientific medicine, and it can help, you know, maybe in like MRIs are really amazing, or like some kind of diagnosis are really amazing, but my dream is to combine everything, but in a really open-minded way, you know, and in a really that you really believe in what holistic veterinarians or doctors say, and don't downsize it and
Or downplay it or downgrade it.
Downgrade it, yeah.
You know, my idea of medicine of the future would be where people actually learn from the animals how to heal, because it's easy for people to come to veterinary clinic and kind of be a little bit open-minded because they drop their guard. They are not as reserved. When it's about their health, they're a little guarded. But when it's about their animals, they're more open to learn. And then I hope that one day...
They do. Very often when clients see the results in their animals, they always ask me, do you have a doctor that works the same way as you do for animals? And they really want to change their life too. And I see them really changing and focusing on healthier diets and changing their water or little things, having supplements as well, and so it really helps. Yeah.
If we are able to survive the conventional era of medicine where holistic methods are ostracized and discounted just because it's not as profitable for the drug companies, they cannot license herbs, they cannot license healthy food.
And they are too cheap.
Absolutely.
Yeah, it's
absolutely.
too cheap. Everything is too cheap. So they cannot make any profit out of it. That's what I mean.
Yeah,
or
yeah.
DMSO, I mean, is really cheap, and they don't want to have it for cancer at all. But I see cancer patients who get really well on DMSO, but they cannot
license it. They cannot have proprietary rights. So they will always steer us and steer the education and universities and the whole process into the area of licensed chemical products. And in my mind, whatever chemical is not natural, it doesn't belong in the body.
And the body doesn't accept it.
Yeah.
It doesn't recognize it even. Yeah, it helps in a certain way, but it always has like 5 side effects. And why do we need all the side effects? And why do we accept the side effects? I don't understand.
When it comes to us really thriving and our dogs thriving, our animals in general, we should really try to have it as a last resort.
Trust in nature. Really
go along with nature. Yeah.
It's always been my phrase when I'm not sure or insecure, that I look what is nature doing. And then I think, okay, when I don't know anything, I just look what nature is doing and I copy that.
It is so funny because I always say, when unsure, look back to nature. Tell me about your idea of what pet food is and how you see it. And how do you feed your dogs? And I know that you have some really kind of revolutionary ideas about how to feed natural
Well,
food.
I had so many thoughts about how the digestive tract works, and it's the first thing that we are all different. Like our digestive tract is so much different to a horse. Like a child knows that, and a cow is different to us. So the dog is really, really different too, and you cannot feed the dog like a human. But the human actually digests easier than the dog or a cat because they are real meat eaters, carnivores. And we are omnivores, so we can eat much more and process much more. So you really have to be careful what you feed. And I always look what the rule for the wild animals eat, and then you try to make it work at home. You know, you don't have to feed prey, but you have to feed fresh food.
Give me an example of what you would feed or what you would recommend to your patients.
So I make really individual plans for every single dog because I look at the tongue and make tongue diagnosis, and it really depends on the tongue and on the kind of digestive tract you have, which food you can digest. And so for example, when you have a really white tongue, you should have really warm food. For example, lamb or deer, sheep, ostrich,
Okay.
that are warmer. Beef is neutral, and then duck is cool. Rabbit is really cool.
Okay.
And horse, or do you say
How about
horse?
chicken?
Chicken is really hot. And chicken is very often too hot for most of animals, especially when they are a little nervous or they have a liver problem. Because chicken is not a really good idea for any dog who is vomiting, because when you vomit, there's always a liver disbalance, and the chicken is really bad for that.
So when it comes to the basics, like you basically recommend meat.
I recommend usually raw meat, like 70% raw meat, and 30% usually cooked vegetables. Like I really like squash and like pumpkin. And I do a little bit of greens, but that depends of how healthy the dog is.
Okay, so when it comes to the meat, like you include also some bones, right? Like when it comes
Well,
to
it really depends how healthy they are. When it is a really healthy dog, you can have bones, of course, every other day or every day, like ribs or tiny bones. No bones that are really
like big shanks because
they
they're too
cut off.
fatty and they break their teeth, right? Like it's exactly right.
If you have 10 dogs, usually 9 of them need something different. You know, everybody needs different vegetables, different food, and usually those tests you make with the blood are not really helpful because they are just like average and they are just allergies. But it's not about allergies; it's really about what you can digest.
Yeah, exactly. When it comes to special processed food diets in veterinary clinics, what do you think of them? Like, would you use them?
It's horrible. It's worse than McDonald's, I always say. I mean, McDonald's is really healthier.
Yeah.
So you cannot eat processed food. It doesn't make you healthy. If you want to have a dog that lives his normal lifespan, you shouldn't eat it, because in my observation, they usually die at least 3 years sooner than if you have them on a healthier diet.
Why do you think the connection between pet food companies and veterinary clinics happen? Like, what is your opinion? I have an opinion, but I'd like to know.
Well, what I saw in our vet school, that they already had salary stands with the pet food companies, and they brainwashed the students, because when I was a student, I believed that this is the most healthy food because it has all the ingredients, it is like scientific proved, and
That's what they said,
yeah.
right? But it
and
is
that's
not
what
true.
you believe because you don't think. And as soon as you start thinking, actually, then you see it cannot work, because processed food has been on the market in Austria for not more than 35 years. And I see a complete declination of health. And why is that? I mean, it should be, if it's so healthy, all the animals should be much older than 30 years ago, right? So, but they die sooner and sooner and sooner. And now an old dog starts with 6. And a dog should be like, I have patients that are dogs like they are 26 years old, or cats that are 26 years old. And that's what I believe every dog should be.
With a little bit of luck, you know, it doesn't necessarily mean that people fail when their dogs don't live that long, right?
But not like they are old and there's no help when they are 10.
Every human doctor says that processed food is not good for us. And then suddenly vets come and they're claiming that processed food is the only thing. And I have even some team members who, from the kind of graphic design department or editing and the kind of more artsy people, they're afraid to actually dive into raw food.
Because they are so afraid of, that they lack something. But we don't actually calculate our diet every day either, and it's not in nature. It's much more sophisticated. You just have to believe in nature, because nature knows when you compare what a dog eats in nature, then you just try to copy that.
So, you know, when it comes to soil depletion, which are happening because we are into this modern cycle of nutrients where we grow food and then we transport it to long distances, and then the soil doesn't get replenished. So as a result, we are missing minerals, we are missing vitamins.
It's also about our life.
We are missing, exactly.
It's our life is not calm and easy. We are not chilled yogis that are sitting all day in a meadow. We are, there are so many busy things going on, and also I see it in the animals. The busier the life is, the more they burn and the more supplements they need, because you cannot get everything from a diet.
Yeah, and that's my experience. When I started formulating supplements, I didn't really know how much difference they can make, and then suddenly I saw
any
the
chemicals.
results. Absolutely, the results of, let's say, giving simple minerals of plant-based form, and the body gets jump-started.
You usually see it within a month. People are so happy within 1 month. They say they have a new dog. The dog is like 3 years younger. He's active again. He's happy again, and it's so easy.
I know that we could sit here forever, and we probably will have more sessions, because I'm so happy to talk to you, actually, always, and be together.
I'm happy too.
Because it's so nice to see you. I'm so glad. I'll have to come and give you a hug here. I'm so happy to be here.
Yeah,
we'll do another interview.
Ah,
Thank you so much, you guys. And we'll be back.